Welcome to clip two of our series here. I'm joined again by Sean Maynard. I'm Mike Janis, both of Brown Gibbons Lang. We're joined by Dr. Michael Fabrizio of Urology of Virginia, as well as Whit Holder, the CEO of Amarillo Urology. The focus of this clip is going to be key drivers of value when evaluating your physician real estate. So to kick off this section, to touch a little bit on where we left off in clip one, which was really revolving around the lease terms as a potential sale leaseback and what that forward lease would look like upon a sale. We touched on a few of the really important factors, a few of those being the length of the lease, to lock in a long-term lease there for an investor to know that the facility will be tenanted for a long time, that rental rate and the resulting cap rate. Again, the ability to pull the lever between forward rent liability and higher forward rent liability equals max sale proceeds versus a lesser rent liability and lesser sale proceeds. And then really the rent escalation, the annual escalators within the lease, and how that it drives the rate of return for investors, makes it more attractive, and ultimately allows an investor to get more aggressive in their pricing of the facility.
That sounds great. So from our standpoint, how we looked at value, first of all, when our group's 100 years old and we joined a health system for 3 years and 10 months, and we decided to exit that health system, we needed real estate. And so we were able to leave our leases with the health system, and we decided to consolidate all of our offices, and we were looking for real estate. We planned this ahead of time. So I wound up going to the economic development meetings at City of Virginia Beach and the City of Norfolk, but really the City of Virginia Beach, which is the center hub. And I found that they were going to build a flyover near one of the buildings that we were looking at. And this flyover was going to be right between the interstates. And so we wound up purchasing that building knowing there was going to be a flyover. That actually had some great benefits for us. Number one, when the flyover was finished several years after we moved in, it added value to our real estate because we were very centrally located. Number two, we had a piece of land in the back of the property that the city needed to purchase. And that actually added some money to our building fund, which was great. And number three, we were able to get an economic development grant from the city because we were bringing jobs to that area using the building. And finally, number four, they were able to help us get some additional parking spaces because there was some city property that they basically did as part of the transaction, the economic development grant, a small little piece of property that gave us another 35 spots of parking. So going to these economic development meetings ahead of time and sort of planning, working with your broker, doing these type of things really helps you understand the marketplace. So that created value. The second thing is that we wanted to have a surgery center. We're a CON state. So we decided to partner with a health system and get a CON, and they were our co-leasee for our surgery center, which we put on the entire second floor. So we have a 5-room surgical center, and complete with a freestanding robot in it. And that was very exciting. And then we actually brought in an independent imaging tenant, meaning they weren't a hospital-based entity. And so they were the lowest cost imaging center in Hampton Roads, and we brought them in our building. So it became a real hub for a lot of the referring docs because it was the lowest cost imaging and patients who sought the lower cost imaging. So all of that added significant value and a great story when we went to sell our building. So that's how we created value.
So as we think about drivers of value for a physician practice, particularly when you're looking at a single tenant building, there's a couple things that really jump out. Namely looking at the financial performance of the practice, at a basic level, right? Just understanding what are the amount of profits that the business is actually generating, right? And this a lot of times can be quantified as we think about rent coverage. And so basically what this is, a lot of you probably heard the term EBITDA. Well, we think about EBITDAR, basically, which is EBITDA, a proxy for your cash flow or your income, but add back the rent amount as well. And you take that total amount and you divide that by the total rent payment. And that's a good metric for, how, what is the risk that an investor would be taking in terms of that tenant defaulting on their rent? Or is there enough cushion there with the profits generated by the practice to sustain those rent payments going forward? And now this isn't as straightforward as you might expect, right? There's a lot of, interpreting a physician practice financial statement oftentimes is, independent or unique to each practice, right? Because you have different ways that, how is physician compensation put into the P&L? Is it all discretionary, or is some of that a base rate plus a discretionary rate? Are there personal expenses that are also going through the P&L? Because oftentimes, this is why it's important to talk to an advisor on these pieces, because, it's important to look at that and say, well, if this is discretionary compensation, perhaps some of this should be added back, right? Because obviously, if you owe rent, you're not going to pay yourself before you're going to pay your rent, right? Sometimes you might have a very robust quarter financially, and sometimes it might not be quite as robust. And your compensation is going to vary from quarter to quarter if that's when you take your distributions based on your performance. And thinking about rent as just another operating expense, this is where isolating some of these items on the financial statement are critically important. Separately then, thinking about the fundamentals of the practice, right? And what I mean by that is, how many physicians work for the practice? How much space are we looking to lease? Separately, so is there key man risk? If you have two physicians, one physician is 62 and the other is 58, is it realistic to enter into a 15-year lease, right? Most investors might look at that a little skeptically, whereas if you have a larger group that perhaps has a good distribution of age for their physicians, that then gives investors some confidence that, look, we're pretty well assured that this tenant will be able to continue to pay rent 5, 10, 15 years into the future.
I think for us at Amarillo Urology, it's funny you speak of that. I think in this situation, we're already seeing that there's not one size fits all strategy with real estate and physician real estate, but we do know that there is a strategy around sell lease back, and it's one that for us came pretty much to the forefront because our practice had 10 physicians. 5 of them basically being in their late 60s, early 70s, and 5 in their 40s. And when we had to retire and buy out those 5 that were in their late 60s and 70s, we were left with 5, late 40-year-old partners with quite a bit of debt. But then the value of a real estate for any other partner to come in would be high because now all of a sudden you're dividing the value of that real estate by 5 and not 10. So your buy-in became really high. And to what Dr. Fabrizio had been speaking of earlier in this podcast, you're buying that real estate asset with no dividends to pay you for the cost of that buy-in over time. And so it's really not a proposition that any new urologist coming into our practice wanted to get or to pay for. But we also knew we wanted to keep our partners equal in our operating and our real estate company. So this buy-sell transaction for us became a lifesaver on a few fronts. One, it took out the need for a new partner to buy into a real estate. And we knew that our rent payments were going to go well into the future, 12, 15 years, because we had a young partnership now. They're all in their 40s. And anyone we're going to bring in is going to be even younger than that. So the companies that we were looking at selling real estate to felt confident that we were going to be able to make our real estate terms. The other piece of that is our partners, like I said, were kind of saddled in debt because they had just bought out 5 partners. By doing this buy-sell transaction, now that they now just had an equity event that helped them clear their debt. And so it was really for our practice and the timing of it, it was a win-win for us. And it was a way for us to basically secure the fact that we were going to be successful for the future and be able to attract new partners to our business. And since then, we've attracted 3 new partners, and it's been a win-win for us.
I echo what Whit said. Ours was a win-win. We had the same issues, but the nice thing that gave our acquirer assurance is we were a little bit older at the time. We've now shifted to a younger population of physicians, but at the time we had such integrated tenants. So we had a very sophisticated imaging center with MRI, ultrasound, CT. We had a joint venture ASC that was robust between a hospital system and my practice. And that gave them good reassurance that nobody's leaving. So in fact, nobody will ever leave that building because of the ASC, really, quite honestly. And pretty exciting. And subsequently, our imaging center was acquired by the hospital system that actually is our partner in the ASC. How about that? So not only that, we help the other independent physician sell their business, although we lost that low-cost care. They immediately jacked up their imaging prices, anecdotally. I think what physicians, not all physicians understand is that real estate can be the key to the entire operations and strategy of a practice, actually. And really not the other way around. I mean, the real estate can be the focus of a practice, and you can do a lot of great things, especially now with all the theragnostic imaging for advanced prostate cancer and soon to be a lot of the bladder cancer products. There's just a lot of opportunity out there, and real estate is sort of the hub where all that takes place.
Great. And then touching on some of the final key drivers of value here, growth prospects are certainly one of the key drivers of value. Growth prospects include, how mature is the clinical business? Is there growth on the horizon? Does the geographic region where the business is located support ongoing growth? And then what are the market demographics, particularly in heavily procedural specialties, understanding the population growth, one, but also that percentage of the population that is 65 and older is certainly a driver of medical demand. It's important, I think, as well, to frame how these healthcare real estate investment groups view themselves. They view investment into a sale-leaseback facility as really an investment into the physician practice. Healthcare real estate investors often view themselves as an outsourced real estate arm for physician practices. So what does this mean? They want to help you grow. Whether that's an immediate need or just down the line, but some of these growth prospects and metrics that I just touched on certainly make the real estate investment more attractive and therefore more aggressively priced in the investment community. Other key drivers of value include corporate ownership. As the ownership sold some or all of the clinical business, this could be a corporate partner such as a private equity group or a health system. And then certainly the physical condition of the building is a key driver of value and really just impacts the investment in the future capital needs from a new landlord and a buyer. This could be replacement value considerations. What would the building cost to develop today, as well as any deferred maintenance or capital needs, roof, sidewalks, parking lot, major systems, items such as these.